Hello. So this is my response to Jennifer, who was in favor of keeping patients on ventilators, regardless of whether or not there are other patients that need ventilators in a pandemic, such as the COVID-19 pandemic. So I wanted to point out two things that were interesting to your argument, that were about dignity and trust, and especially in the sense that we should uphold dignity across all patients, and we should not break the trust of withdrawing ventilator support from patients who really need it. So I absolutely agree that respecting the patient's dignity and maintaining trust are core to nursing, which you mentioned. But I believe that those values can also be upheld even when we do withdraw life support in the case of a crisis like a pandemic. So my main overall thesis is that in the situations where there's peak COVID, a crisis, removing a ventilator from a patient with little to no chance of recovery is not a violation of the dignity or trust. It's just it's ethically necessary to act to save more lives. Um, and so dignity is about recognizing the worth of a person, and not protecting their life at all costs. If a patient is suffering, which most patients on ventilators are suffering, um, and they have no reasonable hope for recovery, continuing life support may also compromise their life, by prolonging their suffering. And another way to kind of go about this would be transitioning them to comfort care, which is a way to honor their dignity and not break the trust between the patients and the healthcare system. We could still have them be on care, have receiving care, but not receiving ventilator support. And also, trust is another thing that you mentioned that's also very important. And families trust us to take care of patients as nurses. But they also want us to have integrity, and they want us to also be honest about the prognosis of their patient or the person that they love and they care about, and to make decisions that are fair. Um, and keeping this patient on a ventilator indefinitely could cause other patients with better prognosis to live, and especially in a very crisis situation like a pandemic, this is also very important. Um, so I wanted to also mention some of the bioethical principles. So beneficence, we are obligated to do the good for most people, and saving multiple patients rather than just one maximizes the doing good. Also non-maleficence too. We are preventing multiple deaths, versus saving one patient. And we can also prevent harm by putting them on comfort care, allowing them to live out the rest of their life, while still receiving care, just not in the form of ventilator support. And then justice and utility, both principles that demand fair allocation of resources and the distribution of them, as well as utility focusing on the greatest good amount of for the most amount of people. And so in a pandemic, we're not really um, able to make the most fair choices, but I believe that this is the best choice, with being able to respect human dignity and respect the trust, like you mentioned, being able to actually give them care, but have them be off of a life-saving treatment where we could save multiple lives at the same time. So I know this is a ethically challenging question, but this is my recommendation and my response to Jennifer.